Hello, good morning, good afternoon, and good evening, wherever you are. Welcome again to Together We Do Better. Today, we're going to talk about type 1 diabetes. So, we're going to start by defining what is type 1 diabetes. It's a type of diabetes where the body cannot produce insulin, and insulin is the hormone that's responsible about lowering the blood glucose level. So if you have no insulin or you're insulin deficient, that means the glucose levels will be high. How do we diagnose type 1 diabetes? Usually the diagnosis happens through symptoms, which is increased thirst, increased urination, weight loss, fatigability, and the other symptoms as we mentioned last time. Also, it can be diagnosed when the people comes to the hospital with what we call it diabetic ketoacidosis, which means there is a high levels of ketones and there is a high levels of glucose, which lead to basically diabetes emergency. Why this has happened? Type 1 diabetes happens because the body has antibodies, works against the pancreas, which means it'll create a defense against the insulin producing cells. This is lead to deficiency of the insulin and subsequently increasing the levels of the glucose. And to treat type 1 diabetes, the only treatment is giving insulin, which is what is the body deficient. How do we give insulin? Usually insulin given through injections. In the cases of the emergency, where there is a diabetic ketoacidosis or very high level of glucose in the blood, the treatment will be through insulin through the drip or intravenously. In a daily basis, the insulin will be given underneath the skin and through injections. Usually injections depends on which regime your body needs, but generally speaking, there is a long-acting insulin and short-acting insulin. The long-acting insulin is the one that lasts either for 24 hours or 12 hours. If it's the 12 hours, you need twice a day long-acting insulin injections. If it's the one stays for 24 hours, that means you need one injection per day. Then you will need to have a short-acting insulin with meals, which will be 3 times a day. There is a different insulin types which last longer, but also there is a mixed insulin. And the reason why it's called mixed, because it's mixture between long-acting and short-acting. And usually that will be given twice a day. There is another way of replacing the insulin through the insulin pump, which gives the insulin need through 24 hours. That means it gives a small doses of insulin through the day, and it will be connected, and it should not be disconnected at any point. Otherwise, the insulin will be not available in the system, and then the glucose will rise. In terms of giving a short-acting insulin, we depends on measuring how much carbohydrates in the meal, and then accordingly we can decide how many units of insulin we need to give. And as a diabetes team, usually we do that through the diabetes training, the diabetes dietitian, the diabetes nurses and doctors. There is different way of calculating how much carbohydrates in the meals. For example, food labels, it can tell you how many grams of carbohydrates are there. Also, there is apps and books that teach you how to do it. We can talk about the carb counting in a different sessions, but for today, what we just need to emphasize is if you have type 1 diabetes, you cannot stop the insulin whatsoever, is a life-saving. That's everything for today. Please stay tuned and we'll speak to you soon. Bye.